PA Robertson?
Oh, hello there.
I had just had some questions about HPV.
Absolutely. HPV, or human papillomavirus, is the most common sexually transmitted infection. It consists of small double-stranded DNA that can infect cutaneous and mucosal epithelial tissues of the anal genital tract. There are more than 150 strains of HPV, and over 40 can infect the anal genital area. Strains 16 and 18 cause approximately 70% of all cervical cancers, while strains 6 and 11 cause approximately 90% of genital warts. In addition to causing cervical cancer, HPV can also cause cancers of the vulva, vagina, penis, and oral cavity. About 95% of anal cancers and 70% of oropharyngeal cancers are also due to HPV. Transmission is through direct contact via microtears produced during sexual activity, particularly in the transformation zone of the cervical epithelium. It can also be spread from mother to baby during childbirth.
Hi Hannah, how are you doing today?
Hi, I'm okay.
You doing well? I'm so glad you're back in the office to see me today.
Yeah.
Anything new that you wanted to discuss today?
Well,
Hannah has a new boyfriend, and I'm really worried she's going to go too far with him and get pregnant or get some sort of disease. So I want to know what we could do for her to prevent any of that.
Well, she hasn't gotten the HPV vaccine yet, and since she's 12, we can start her on that.
what's HPV?
HPV is a disease that is transmitted sexually, and it leads to genital warts or cervical cancer. So it's usually administered in a round of 2 vaccines, and since you're 12, you're lucky you don't have to get the 3-round vaccine. So we'll start today, we'll administer her first one, and then in 6 months we'll give you your second round.
That sounds great. Let's get her started right away.
PA Hines,
Oh, hey again.
can you tell me how HPV presents?
Sure. Well, PA Hines, you have a patient in room 7. All right, walk with me. So I bet you're wondering, how does HPV present? A lot of the time, it's asymptomatic, but it can present as a 2 to 3 centimeter lesion around the genital area, which could be the vagina, the anus, or the penis. A lot of the time, it can cause bleeding or discomfort during sex. It can also appear as a cauliflower-like lesion or a flat lesion.
Hi, are you Mallory?
Yes.
Hi Mallory, my name's Tracy. I'm going to be your provider today.
Hi, I'm Debbie, Mallory's mom.
Nice to meet you both. I see you're here for a sports physical today. Is there anything else going on?
No, I have to do this for cheer, but I feel fine.
Okay.
We just wanted to see what we can do to get her cleared to play for cheer.
Okay, perfect. Well, it looks like all of your immunizations and things are up to date. We'll take a look and listen over everything. Now, has Mallory gotten the HPV vaccine?
What is that? None of her doctors have mentioned that before.
HPV vaccine, it's a shot started around ages 11 to 12 in women. It protects against human papillomavirus, or HPV, which can lead to cervical cancer or genital warts.
HPV.
How would she get that?
HPV is contracted through sexual contact.
Oh no, Mallory doesn't need that. She's only 12. She's not having sex.
Mom.
I understand Mallory's not currently sexually active, but it's just for prevention in the future. It's lifelong protection from several strains of HPV, like I said, that can lead to cervical cancer or genital warts.
Okay, I understand, but I don't think we need that today. Mallory's smart.
Okay, no problem. I'm sure you and Mallory have a great relationship, and you guys always know where to find us if you do change your mind about that vaccine. We'll send you home with some information. Otherwise, good luck with cheer tryouts, Mallory.
Thanks.
Clinic's crazy today. I know, right?
PA Robertson,
Yeah.
can I ask you some more questions regarding the HPV vaccine?
Absolutely. I'll catch up with you. There are currently 2 HPV vaccinations available, Gardasil and Cervarix. Gardasil is recommended for both boys and girls and covers strains 6, 11, 16, and 18, or the main strains that cause genital warts and cervical cancer. Cervarix is recommended for females only, as it only covers strains 16 and 18. Neither HPV vaccine contains live virus, and both can be given after the contraction of HPV to protect against future infections. While there is no evidence that the vaccination causes any harm during pregnancy, it is not recommended for women who are or could be pregnant.
PA Robertson, there's
Yes.
an emergency.
In addition, it is still important to continue routine cervical cancer screenings following vaccination. I'll be back.
Hey Hannah, how are you?
Good, how are you?
I'm doing well. I'm so glad you're back to see me.
Yeah.
So what brings you in the office today?
Well, I wanted an STD test. I've had some new partners lately and haven't always used protection.
Okay, so a lot more partners, not always using a condom.
Yeah.
Okay, well we can do that today. You're not having any symptoms and you have normal bleeding though?
No, and I know I'm not pregnant. I've been on birth control.
You're on birth control
Yeah.
still? Okay, good. So just the lack of condoms is your concern?
Yeah.
Well, you did get that HPV vaccine, remember when you were
Right,
12? And
right.
yeah, so you're protected from the genital warts, and that also, remember, protects you from the cervical cancer, but it doesn't protect you from all the other STDs. So we'll go ahead, we'll get you tested today, and then in the future, just try to be a little safer and practice, safe sex.
I'll be more careful.
Okay?
All right.
All right.
Thanks.
Of course.
I only have a minute. My patient's in there. But to diagnose HPV, it's mainly by clinical presentation. Or you can do DNA or RNA capsid detection or tissue biopsy. Mallory?
Come in. Hi Mallory, how you doing today?
Hi, I came here as soon as I could. I got your message. What happened? What's wrong?
Well, we got the results of your pap smear back and it looked like there was just a little bit of abnormal cell growth, which can be caused by some of the strains of HPV that can potentially lead to cervical cancer. So we need to do some more tests. We don't know anything yet, but we'll just need to run some more tests.
Cervical cancer, what are you talking about? I waited, I've only been with my husband. I thought I did everything right. Cervical cancer, how did I get that?
Well, we don't know yet. We need to do some more tests. We'll figure it out, but we'll work together and get through it, okay?
Okay.
PA Hines.
Oh God, you startled me. I didn't see you there.
I was wondering if you could tell me a little bit about HPV treatment.
Sure. HPV treatment depends, varying on the location of the lesion and the size of the lesion. So there's two different topical creams available. One that's applied by the patient themselves and one that's applied in the clinic. So the three that are applied by the patient themselves are Podophylox, Imiquimod, and Sinocatechins, which is a green tea extract. And then also topicals that can be applied in the clinic by the clinician. And that includes podophyllin resin and bichloric or trichloroacetic acid. So bichloric or trichloroacetic acid can be used in pregnancies, whereas podophyllin resin cannot, and it's absorbed systemically. So you have to be cautious, but it's based on patient needs and what the clinician and the patient decide is the best treatment.
PA Robertson, PA Hines, before I head out, any last thoughts for me?
Sure, let's talk about prevention. Safe sex is the best way to prevent all STIs, including HPV. It is recommended to avoid high-risk practices and to ask potential sexual partners about their STI status. HPV, like other STIs, is not limited to the vagina or penis. It can be also transmitted to the oral cavity and the anus. The CDC recommends that both boys and girls receive vaccination against HPV between the ages of 9 and 26, but keep in mind that vaccines only protect against the most common strains that cause cervical cancer and genital warts.
79 million Americans are currently infected with HPV, and 14 million people become newly infected each year. It is estimated that most sexually active adults will be infected with HPV at least once in their lifetime, and sexually active women under the age of 25 have the highest rates of infection. Approximately 1 in 100 sexually active adults in the United States have genital warts at any given time.
All right, well, thank you guys so much.
You're
You're welcome.